The purpose of this video is to demonstrate a procedure known as a central slip tenotomy, which is the division of part of the extensor tendon that goes to the middle finger in order to increase the pull of the side tendons in the finger towards the end of the finger, known as the distal end or the terminal extension. This is to treat a chronic mallet finger or disruption of the extensor mechanism towards the fingertip that was unsuccessfully treated with closed means. An S mark or a rubber band, broad rubber band, is placed on the arm, and then a tourniquet is inflated, in so doing preventing bleeding from occurring at the point of the surgery. A transverse incision is made over the top of the finger just before the middle knuckle of the finger, brought down through skin into the fatty tissue under the skin. Great care must be taken not to injure the extensor tendon. The tissue is then spread, exposing essentially three tendons: the two side tendons, which must remain intact, and a central tendon, which will be divided presently. The skin on both sides of the incision are undermined so as to increase the visualization of the tendon. Retractors are used to spread the skin apart, and a scalpel is then introduced at the tendon once visualization of the side tendons has been done. It is very important not to injure the side tendons, or an extensor lag or inability or difficulty in extending the middle knuckle will occur. That is considered a very bad outcome. The two longitudinal incisions are made into the tendon, and then these are joined by two transverse incisions, creating a small box of tendon tissue of about 3 to 4 millimeters square, and this is removed out of the finger. Many times the extensor tendon tightens up immediately, bringing the end of the finger up in the operating room. This will occasionally occur. In this patient, however, unfortunately, the end of the finger is not only bent, but has also been allowed to contract over a period of time, so that a manipulation of the end of the finger will have to be done because of secondary tightness of the ligaments have resulted from the chronic mallet or flexion position of the end of the finger. Once the skin incision on the central slip tenotomy has been closed, a passive manipulation of the end of the finger will bring the finger out into full extension. Following this, the alignment is then checked on the X-ray and seen to be free of a contracture, and a wire is then passed from the end of the finger through the distal phalanx, that's the first bone, towards the end under the nail, and then off into the second bone called the middle phalanx. The pin is cut proud of the skin. Occasionally, the skin on top of the end joint can be opened, and the extensor tendon can be repaired as well. In this patient, this was not deemed to be necessary. Post-operative X-ray shows that the pin is through the bone and stabilizing it.